What's that? Oh,
Please join us in the Pledge of Allegiance. I pledge
Pledge
allegiance
allegiance to the flag
of the
United States of America,
to the republic
the republic for which it stands,
one nation,
nation under God,
indivisible,
indivisible,
liberty and
liberty
justice.
and justice for all.
And next, the four-way test.
Of the things we
Things
think
we think, say, or do.
Is it the
Is
truth?
it the truth?
Is it fair
Fair
to
to
all
all
concerned?
concerned?
Will it build goodwill and
Goodwill and
better
better
friendships?
friendships.
Be beneficial to all
Be beneficial to all concerned.
Excellent work, everyone.
Thank you. Somebody walked by my office last week and was like, "That's the worst thing I've ever heard." Our thought for the day today is Adrian Strick.
Adrian, you should
All
all
right,
set to share.
I'm gonna briefly share my screen. Hold on, just bear with me for 1 second to get there.
I don't know what that is.
Okay, sorry, you guys. I'm just, oh, here we go. Have you got it?
Yep, we got it.
Okay. First one, gratitude unlocks the fullness of life. It turns what we have into enough and more. It turns denial into acceptance, chaos to order, confusion to clarity. It can turn a meal into a feast, a house into a home, a stranger into a friend. Gratitude makes sense of our past, brings peace for today, and creates a vision for tomorrow. And then I've got a couple more. This one is a card that I love. Everything will be okay in the end. If it's not okay, it's not the end. This next one is a little outdated, but I loved this, 2020. And last, apropos of nothing, but I love, this is one of my favorite Instagram pages, baby animal pics, and it's like kittens and puppies. If you can't get a smile out of a little baby cow. And that's it.
Good. Thank you.
Thank you, Adrian. Would you mind sending those to me so I can include them? Thank you. Could we take a moment to introduce our guests and visiting Rotarians? Go ahead and speak up if you have a guest or are a guest.
I have a guest who is actually put in her application for a membership, Jennifer. Hey, say hello, Jennifer.
Hi, thank you all for considering me being a member.
Thanks for joining us, Jennifer. I think that looks like it. Sonia, we'll give you a good formal introduction here in just a few minutes. Announcements. Carl Gills, you're up first.
What am I announcing? Is this for the approval of the bylaws?
Yeah.
Yeah, we sent out a couple of weeks ago the bylaws revisions, and I did get some comments. Nobody suggested any substantive changes. There's some technical changes, punctuation, capitalization. There are a couple of things that we restated to make it a little clearer, but rather than send out an additional copy and confuse people, just if what we approve will be approved with some technical changes that were received. It looks like we've got our quorum of 33% of the membership, so we need a motion, second, and a vote.
So moved.
Thank you, Rich.
Rich Gore is
Sorry
the
about it.
motion.
Second.
Was that Philip?
Yes.
Okay. A motion by Rich Gore and a second by Philip.
All in favor?
Aye.
Hi.
Rich is auditioning for my job.
Thank you. I will get those changes made permanent and get those posted on the website sometime this week.
Thank you.
Carl, thank you for
Thank
all you
you.
did on that. That was quite a task, and we appreciate you for taking it
welcome.
on and seeing it through.
Glad to do it.
Mark Fitzgerald, would you like to go next?
Happy to. As most of you know, for time eternal, Steve Sainert has been managing our Club Runner site. And with his upcoming duties as the district governor, he's not going to have the time or bandwidth to do that kind of work anymore. So we need a volunteer to basically make sure things are running tightly there. Steve, I don't know if you want to speak more to the details about what's entailed as far as Club Runner management. I know it's pretty straightforward in that anyone with a passing familiarity with the internet should be able to do a pretty good job, but maybe you could do a better sales job than I.
Yeah, well, thank you for bringing that up, Mark. And yes, Club Runner is our protocol for our Rotary Club to be able to offer a website. It's really not that difficult, and I had worked with it before I moved to Steamboat, so I was familiar with it, and I've just sort of rolled with it as we've gone through the years. But as I transition more into this role of district governor, I'm going to need some help with this, and I'd be happy to sit down with anybody, show you a little bit more about how it works. But what I do on a routine basis is update the weekly recaps that Jillian's been writing about what occurred in our meeting, and make sure that the committees and the officers of the club are in there correctly. Our club secretary, Holly first, and now Tiffany, are entering the new members and taking off members that have resigned. So they're doing that part of it. But I just need some help with the more routine parts of administering Club Runner. And I'm looking for someone who would like to step up and volunteer.
This might be a good way for a relatively new member to get more involved. It's something that can be done now, during COVID times, obviously, but will continue clearly beyond that. And with Steve offering to sit down with you, I wouldn't be surprised if he would offer to ply you with some alcohol as well, as a way to convince you to do this.
Yeah, everybody knows I'm a beer guy, so I've always got lots of unique beers around.
So Steve, would you prefer people to reach out to me or to you, or?
Reach out to me. If just send me an email and tell me if you're even mildly interested, would like to know more about it. If you have questions, I'm happy to answer those, and let's see what we can do here. It's not something that has to happen like this week or this month even. It's just something we need to start doing some transitioning and learn how to use it.
Great. Thanks, Steve. Thanks, everyone.
Thank you, Mark. Thank you, Mark.
And thank you,
Thank
Jill.
you both. We'll all come together and make sure that we find a good replacement for you. It's a really powerful tool and a really good way to get familiar with Rotary. So I do love the idea of a newer member taking that on as a way to get involved. Karen Schneider, you're up next.
Good afternoon. I just wanted to give you a brief update on the Youth Exchange Committee. We are working to create updated student and parent guides for our future exchanges. And while we're not hosting any students this year, we are hopeful that we will begin to recruit for the 22-23 school year. Obviously, that will be dependent on the district and where we stand with COVID, but that's our hopes. In the meantime, we are inviting all current and new members of our club to join this committee. We have a great group of people that want to do the best job that we can as a club to host inbound students and support our outbound students. If you're interested or you would like more information, please don't hesitate to contact me or one of the committee members. Jillian and I will send you a list of those committee members so that you can post that in your committee updates, and feel free to reach out to us. We would love to have you.
Are there any other announcements that you don't have on my list?
Yes, manic
Hit
update.
it, PJ.
All right. I am representing Linnea South. So the Manic crew has put together a great opportunity to get outside either on a solo basis or duo or with a team or the group of friends, etc. March 5th through the 7th, and this was sent to you via Club Runner on Saturday the 20th from Linnea. we are putting together a benefit, an outdoor fundraiser for Lift Up of Routt County. And the idea is that you would have the opportunity to do up to 22 miles of events, very, very similar to the former pentathlon, but this one is actually a little bit more creative because you could basically ski and snowshoe or hike to the top of the Christie Lift or the Lane of Pain. We're gonna have mountain biking a County Road 44, 14 miles, or snowshoeing Molly's, or the Borden Ranch Nordic Ski, which is out on Elk River Road, just by Collins Corner. So this is a great opportunity to get out, to either be with friends, to go solo. And again, it will be benefiting Lift Up of Routt County. And for any Rotary Club member, there is a $10 off registration. The registration is $50 a person, which covers the expenses, and then also will make a donation to Lift Up. But anybody for Rotary, if you put in, again, go to the email and reference Rotary, all caps, ROTARY, each of us would get a $10 discount. So should be a lot of fun. It is not a race. It is about having fun. It's about decorating. It's about costumes. There's going to be a competition for who has the best bib, who has the best costume, et cetera, et cetera, et cetera. So a great way to get out this winter and blow off some steam. Thank you.
Thank you, PJ. PJ, if people want to put a team together, how should they coordinate?
Yes, on the website. And I will make sure that we get this website out to everybody. You just basically sign up together as a team and you identify as a team. There's a short course, which is 22 miles. There's a long course, which is 33 miles. And the whole point is you can do whatever you want. You could do one section, you could do all of them, you could split it up. So it really doesn't matter. It's as much as any one person would like to do. So again, if you sign up for a team, you just have to identify your teammates.
Fantastic. Thanks so much. Any other questions? PJ or Linnea, I guess, will be your contacts.
Yeah, we'll get this email out again, which has all the website signups, etc. And we hope we can join the crew. Adrian, Lindsay, Jillian, Ashley, Chuck, Laura Seenert, and Eric Rabisa will all be out there, won't you?
Fantastic. Loretta, I see your message. I'm taking over for Jillian for a moment. So as soon as I'm able, I'll get to that. Unless there are any other announcements, we're going to go ahead and continue with our program. We've got Karen Schneider back again to introduce Soniya Fidler from Yampa Valley Medical Center. Karen?
Thank you. So it is my honor to introduce you to Soniya Fidler, president of the UCHealth Yampa Valley Medical Center. Soniya has the classic steamboat story. She arrived here 20 years ago to be a ski bum and ultimately decided to make this amazing community her home. She's been with YVMC for more than 15 years and in her current role as president since late 2018. In addition to leading a hospital through a global pandemic, she serves on the Old Town Hot Springs and Chamber Board and is also a member of the Morning Rotary Group. She's the proud mother of 12-year-old Kalkin and 9-year-old Sahira, and her husband Frank is a valuable member of Ski Corps' maintenance team. The family enjoys camping, snowboarding, and mountain biking. So please, Afternoon Rotary Club, welcome Soniya Fidler.
Hi, thank you. Introductions are always so embarrassing, but Karen, you did a great job. Thank you for that. I'm going to share my screen here.
Looks good, Soniya.
All right, great. So yeah, thank you again for having me. Appreciate it. Just love to touch base with different groups throughout the year and provide updates at what's happening at the hospital. Of course, we had a crazy year this year, but we also had normal operations and have accomplished a lot through this year, as well as addressing the pandemic. So just have a few slides to kind of go over with you all here. Okay. So just a quick agenda. I was going to go over some highlights from last year, talk about things that I talked to you all about. It's been probably a good year and a half since I met with you all. as to what has happened with some of the projects that we were embarking on, our emergency department, Steamboat Surgery Center, some behavioral health updates, and then really just adding COVID as something that was unexpected and something that we definitely had a lot of focus on. So just some highlights from last year. You probably remember hearing about Memorial Regional Health and Craig suspending their OB services late in 2019. So we did absorb that obstetric population from the hospital. At that time, we created a midwifery program, and so we hired 2 certified nurse midwives to complement our OBGYN physicians, and it's been very great and successful. We anticipated probably just under 100 additional births from Craig coming to our hospital, which we are seeing. Our providers had been going out to Craig even prior to Memorial Regional Health suspending their services. So we just added additional days so that we could serve that population. And it's been very welcomed. I know it's a scary thing and a scary time for the residents of Moffat County worried about being able to deliver in close proximity and that sort of thing. So we've definitely worked really closely with those patients to ensure that they feel safe with their care and that we're there for them. We did hire Dr. John Hamilton. If you know him, he was part of Steamboat Medical Group. He is now in our primary care clinic out in Craig. That happened, I want to say, last June. So very fortunate to welcome him. It's amazing to hear all the patient comments from the residents there as just how happy they are to have him there. And then also just people who from Steamboat are now following him to Craig to maintain seeing him as their provider. Last time I presented, we talked about our Community Health Benefit Fund, and I will talk a little bit further about that. But since then, we did distribute the grants totaling $275,000 to 14 local nonprofits last year, and we are in our grant cycle for this year that we're in. We also have a visiting provider, Dr. Aaron Fry, who came and he started providing some plastics and reconstructive surgery here. He is based out of Fort Collins, and he comes out here as needed, but at least a couple times a month. And he's been received very well. Our main intent with bringing him here was to focus on breast reconstruction. We realized that a lot of our patients were either forgoing that option or having to travel for that service. And so that was our main focus. But since he's been here, it's opened up a lot more opportunities for him to provide additional services as well. And he's really enjoyed being here too. So I think he, of course, as we all do, enjoys Steamboat. And then really amazing providers that we were able to have join part of our medical staff this past year. Neurology, we have a full-time neurologist now. Prior to that, we had a visiting neurologist. So Dr. Tracy Vargas joined us. And then Dr. Nicole Cotter joined us as a part-time rheumatologist. So 2 service lines that we know were in high demand for our region that we finally have, and again, have seen really great reviews from our patients in regards to those providers. And even, like, again, as I wanted to point out, I mean, we've had a lot of ups and downs through 2020, but our focus continues to remain on our patients and ensure that we're providing the right services to our community. UCHealth continues to be the largest provider of Medicaid in the state of Colorado. Essentially, we care for 1 out of every 4 Medicaid patients. So, still maintaining that. And then, of course, we've made a lot of progress with our emergency department renovation. So you see some pictures here. This is about a $10 million project, and thanks to Karen and the foundation board and the foundation team, we've actually been able to raise just over $2.3 million to go towards this major project. And it's just a great, I mean, it's almost a surprise every time that Karen tells us about a generous donor. I mean, it's not just little donations. We've received significant donations, and from community residents, from visitors, all kinds of different donors, really showing their appreciation for the services that our emergency department provides. And through that, we've also always touted our patient experience scores in the emergency department, maintaining in the 99th percentile. And even through the renovation, we've been able to maintain that. And really 99 is pretty much 100. I mean, you can't get to the 100th percentile. So as it says up here, we have 10,000 square feet of what we're renovating here, and also doing it while we're providing services. We've been able to maintain our level 3 trauma designation. If you remember when I presented last time, I talked a little bit about this as to, this trauma designation and how many patients we're able to keep in the Valley and provide care for, and not having to fly out and not having to incur that flight cost and those types of things. So we've been able to maintain that designation. And we're looking at mid-May for target project completion. When we first planned this, looking this far out, we were like, how can it be? How can we get through the ski season? Of course, this is pre-COVID, but how can we do this? And actually, COVID was a good timing for us to be able to renovate in addition to taking care of our COVID patients. So what this renovation also brings is, of course, a dedicated patient entrance. So you see in this picture on this screen, these doors on the left here are what was the ambulance entrance, and you probably know that it was always confusing as to what door does the patients walk in, what door does it, do the ambulances go in. So now we have this big patient entrance that will be very visible to patients as walk-ins, and then that will still remain as our ambulance. We have physical therapy space that's a little bit different than other EDs in the system, in that we do see a lot of ortho injuries, and so we have actually physical therapists who will just fit our patients on whatever it is, crutches or whatever, medical equipment that they need in order to take care of themselves. So we have a dedicated physical therapy space, a counseling room, and mainly just new private treatment rooms. We also have a sexual assault response team room that's dedicated for any type of exams that require that, and it has an adjoining restroom. So that's something that we didn't have in the past. That we're really proud to be able to offer now. And then a new care team station, just, with ample staff, just ample room, ample, just good workflow, good ways for everyone to have an eye out on all the patients in their private rooms, and just a really good kind of flow that we didn't have before. And so just some additional pictures here. This is when you walk in on the left side for the registration. And then on the right is kind of that horse track, if you will, type of layout, so that all of our care teams can have an eye out on every patient from the care team station. And then phase 3 consisted of these trauma rooms that you see here. So 2 times larger than our current trauma rooms. And this is scheduled to actually open tomorrow. So phase 3 is opening up tomorrow. That consists of a lot of our back office functions, staff lounge, call rooms, that sort of thing, as well as these additional trauma rooms. And it's really cool right now because I can walk through, see the trauma room, and then walk into the current ED and see the old trauma rooms and see that contrast difference. And oftentimes when we have a trauma in our current trauma rooms, you have the care team spilling out of the room. And this just allows for such a greater ability for our care teams to be in the room, everyone present, everyone, just really focused on the patient, and then really good access on one of the trauma bays too, as far as getting them into imaging and or surgery if that is needed. And then I did talk to you about, at the time we were talking with Steamboat Orthopedic and Spine Institute, and we had just created a partnership to open up an ambulatory surgery center. So here is the logo for that. It's called Steamboat Surgery Center, and it is in partnership with UCHealth, but it is, like I said, a partnership between the independent ortho group as well as the hospital. And this is something that, from what I hear, has been, just been talked about and tossed around for probably over 15 years. And I think really the driver of getting to where we are right now is to have the orthopedic groups come together and form one practice. So shortly after they had done that, it made it really easy for us to create this partnership and come together to benefit the patients. And really taking, a focus on just this active lifestyle that everyone in this community has, whether, no matter what age. And so we have opened just this past fall in what was the prior Sports Authority building located in the Wild Horse Plaza. And essentially, just to remind you, the Ambulatory Surgery Center is really a structure or a facility that allows patients to receive their outpatient surgeries just in a more convenient setting, not coming into a hospital. This is all we do is we, have surgeries that are done in the Ambulatory Surgery Center. And it's usually a little bit more cost effective as well because we don't have the overhead of the hospital to cover. So, of course, it's not intended to replace the need for complex inpatient surgery or long-term hospital stays that are required, but it does offer still high-quality, cost-effective outpatient options for most of our surgical cases. And it's not right for everyone. So it is a dialogue between the patient and the surgeon on what's right. If the patient has other medical conditions, things like that, we would have those high-risk procedures still done at the hospitals. So we did have to go through a lot of licensing and regulatory reviews with the Joint Commission, the state. So we went through all of that in the fall, and we started to do cases. It is still a slow ramp-up period. We have a lot of payer contracting that needs to be completed still. And so that's still in progress. I would anticipate that probably by the end of March is when we can anticipate like the full kind of, transition of cases that are eligible to happen in an ambulatory surgery center happening over there. And then behavioral health updates, as I said earlier, with the Community Health Benefit Fund. So we did have our inaugural grant cycle. It went very well, very successfully. And I do want to take a moment to thank, Karen Schneider and of course, Mark Fitzgerald and the rest of the foundation board. But both Karen and Mark took an active lead role in creating the structure around this. And for an inaugural event, it really went very well. And of course, we have learning opportunities that we'll adjust to in this upcoming year. But we were able to grant the $275,000, sorry, I'm seeing some typos here, to the 14 nonprofits in both Routt and Moffat County, to the communities that we serve. And we had the funding priorities of access to care, mental health, and substance use disorder. This upcoming year, the boards have actually approved 50,000 additional monies to go towards this granting cycle. So we have an ability to reward $325,000 for this upcoming year. And as I said, we are in the grant cycle. So right now we are accepting applications, and I know nonprofits are submitting those as we speak. As you all know, we are now, the school donation with a partnership with Craig Scheckman Family Foundation, the 5-year $1.375 million commitment to go towards behavioral health initiatives. We are in year 3 of 5 of this in this current school year, and all the time, we hear how beneficial this has been to the students, and especially from our pediatrics practice. The independent pediatrics of Steamboat Springs reminds us almost every time we meet how beneficial, and that I think is really telling, because they get to see the kids on an ongoing basis and see that the benefit of having behavioral health services in the schools is really helping on the other side. We continue to, we announced the $100 million investment that UCHealth has committed to go towards behavioral health in the next 5 years. That first phase, the first tier, if you will, was to essentially focus on integration of behavioral health within primary care. So we don't really own a lot of our primary care here. So we're focused on, Craig and ensuring that, but what we do want to do is still offer that service to those independent providers. And so what we've really focused on is a better referral process between the primary care physicians to our licensed clinical social workers and psychologists, and just really addressing that in, kind of in an earlier comprehensive way where our PCPs can get their patients to their mental health resources for our patients, so that we can, focus on mental health just as much as we do physical health. And I think that that's really important that we are focused on, as well, is to reduce the stigma around this. It seems that it's okay for all of us to focus on our physical health, and we want that importance to be put on mental health just as much as it is for our physical health. So how do we do that? And that's why the integration of behavioral health as part of your primary care visit is a way that we feel will accomplish that. And we'll continue to invest in different ways, whether it's telepsychiatry or hiring psychologists, psychiatrists, and those types of things as far as the next phase goes. And then, of course, just wanted to, I have a lot more pictures here than words, but just our continued COVID-19 response and readiness. Yes, it's been a whirlwind of a year, things that we would have never have imagined or predicted, but it's been pretty amazing, and just outstanding to see how people respond in a time of crisis. It's funny because we practice these things, and we have mass casualty drills, and we do emergency management preparedness, and we often come up with the craziest, wildest story of, what if this happened? How would we react? How would we take care of our patients? And we practice those things. And, oftentimes you get told, why are we doing this? This would never happen, right? And this is just a classic example of what we prepare for. We prepare for pandemics. And we often think that it's not likely to happen, and it did happen. And I think all those preparations came into good use. So some of these pictures just to show you. So the one here on the left top row, we did put a fast track tent out in the parking lot of the emergency department early on in the pandemic, and thankfully we never had to use it, but it was good for us to be ready and be prepared at that time. We didn't know what we were expecting, and so we were able to do it. And then once we took it down, we knew that if we were to see a surge again, we knew how to do it, and we would have done it probably in half the time that it took the first time. You know, and this is just, you know, pictures of our folks wearing PPE and just all the work that went into that, just the different layers of PPE. This third picture here on the top row, I really want to point out. So it's our first administration of a monoclonal antibody treatment, and you've probably heard about this in the news. We actually joke around about this word because some people can say it really well and some of us can't. I've been practicing, and so I'm going to try it. But it's called bamlanivimab, which is this treatment that when someone is diagnosed with COVID-19, if the provider feels that this would be a beneficial treatment for them, they can refer them to us, and we can administer it as an infusion treatment. We have actually administered 35 of these since the beginning of December. So really well received, and you know, just this ability to flex resources. And so we have assessment collection center that you see down here. Bottom left hand was when we were doing it on the corner of Walton Creek and Highway 40, and then we moved it to be on campus in a trailer. I mean, so it's still a drive-through, but we have staff, we have equipment and all the supplies, and we need a house for that. So we still do the drive-through of the test site. And then also, like I said, you know, we have this now treatment lab. So we need to redirect resources and staffing, and everyone's just really stepped up to this and pitched in, and this dedication and commitment of all of our employees has just been tremendous and just really amazing to see. And yeah, and now of course also I'll talk a little bit, but we have the vaccine clinic, so another place where, you know, people were having to redirect resources. So this is a graph that we put on our website to show you system-wide. So the 12 hospitals that are part of UCHealth, the current hospitalizations that are related to COVID. So this kind of gives you a general idea of since the beginning of the pandemic, our peak in this last spring was at 263 hospitalizations. Our our lowest was last fall at 33, and then you see kind of that surge that we talked a lot about this fall, and how much it exceeded what we thought was a pretty significant peak in the spring. So we hit our peak of 469. And now we're down to 99. Actually, we're down to 87 as of today. This is as of February 17th. So it's just really good news that we're seeing this decline. But as you can imagine, not just the 263, but also the 469 really stretches our resources and our staff, and it can be very tremendous work and pressure on all of the caregivers. So the downward trend is great. We feel that this really attributes to a lot of the work that public health has done and all of our residents, but then also the fact that we're administering vaccines. I will tell you that when we were just seeing the pandemic rise and seeing the 263, I don't think I would have ever imagined that in the same year that we would have been administering vaccines. So it's pretty cool to be able to see that. And I think I had it written down, about 284 days since we saw the initiation, the first COVID patient here to the date that we administered our first vaccine. So pretty cool stat to see, considering all that we went through. And then just, really wanting to stress that we couldn't have done this without the community. I mean, the support was and continues to be absolutely incredible. I mean, just these little things, it's amazing how far little things can go. So just like signs, that we would come to work and signs would be outside on our doors. Businesses that were buying our staff meals and coffees and sending us gifts. We had donations of Smartwool socks and grocery delivery services, restaurant gift cards, I could go on. And just these notes of encouragement. We had notes of encouragement, like you see this second one. We actually had these put on the car windshields, and I had so many responses from staff just saying how much that made their day. after, a hard day. So just some examples here of just all the support that we received from the community, and really, the one thing that we just always continue to ask the community is ensuring that there's just support in the commitments of containment, because we do truly believe that's what's working. And then it was a great day. It just gave me the chills just to see it, of the vaccines and when we got our vaccine. So as I said, March 8th was the day that we admitted our first COVID-19 positive patient, and December 16th was the day that we received our first COVID vaccine. And then the following day was when we administered it. So 284 days between the first patient and first vaccine administered. It's still every clinic that we have still brings the same emotions as that first clinic. It's just so great to see that the excitement of our staff wanting to be part of the vaccine clinic, and just the response from our community and wanting to receive the vaccine. So just, kind of showing you the transition of vaccine administration. We started off with our first nurse and our first doctor in the emergency departments. We moved to our first responders. We see one of our members here, Chuck's picture right there. And then, eventually moved to the educators, and we had the school teachers here. So as far as numbers, as of 8 a.m. this Monday, we have received approximately 5,300 doses. We've administered just over 3,500. Of that, just over 2,300 are first doses, 1,200 are second doses. And 90% of those vaccines are staying in the county. I know there's been concerns about people coming here to receive vaccines, and I know also our residents have received the county to receive their vaccines, but 95% of these vaccines are touching Routt, Moffett, Grand, and Jackson counties, or seasonal homeowners. As a system, we've administered over 215,000 vaccine, with about 140,000 of that being the first dose. And all of that, so looking at those numbers, 101,000 of those are people 65 and older. And of course, we have definitely vaccinated the vast majority of staff and providers as healthcare workers fell in that additional phase, or that tier. The partnership with Routt County Public Health has just been amazing. And not just Routt County Public Health, but all the different medical providers and all the different entities that have to come together to plan, and just all the different, touch points that we have to make with each other. Definitely one of the silver linings out of COVID is just these enhanced relationships. We've always had them, but we all, do our job and put our heads down. That's really opened our eyes to all the different entities and what they're doing, and how we all can work together and be stronger when we're working together. And then, of course, I know that this is a big question for everyone, is just how do I get my vaccine? How will you know when it's my turn? And so these are multiple ways of getting that. So if you are a patient of UCHealth and you have a My Health Connection account, then you're on the list already. You'll be notified via email and the app. The app is also web-based, so if someone doesn't have a smartphone, they can still access My Health Connection through the web-based app, or the web-based site. And if you have been a patient of UCHealth but don't have the app, again, you will still receive a call when that happens. We just won't have the ability to contact you through the app. And then, of course, if you're not a patient but do have access, you can create a My Health Connection app. You don't have to be account. You don't have to be a patient of ours, and then that is an easy way to be notified. And also, of course, if you're not a patient and you don't have access or don't want to have anything to do with a smartphone or a computer, we do have a vaccine hotline that's open 7 days a week. We offer translation services through that hotline, and as you see, a dedicated language vaccine hotline as well for Spanish. Also, if you're a caregiver for somebody, or of somebody who would have problems, getting on or accessing any of these 4 options, caregivers can also help patients create their account on My Health Connection, or make that phone call to the vaccine hotline. We know that would be important. It is really important for us to follow the state requirements as far as their established tiers. So currently we're in that tier of 1B3, which is the residents that are ages 65 and up. and the educators and childcare workers. It is important for us to really not deviate from that, to not jeopardize any future allocations. I will tell you, I mean, hospitals, health systems, we're not usually in the business of vaccine administration. As you know, you don't come to a hospital for your flu shot or your shingle shot. It's usually pharmacies or your primary care providers. So this is different for all of us. And I think what the state has seen is that health systems, we do have access to technology. We have access to getting notifications out to a wide base of patients. And we can do it really well, and we can do it efficiently and effectively. And so the state is relying on hospitals and health systems to continue to be a part of this endeavor and get those vaccines in arms. And that is our goal. And when those vaccines come in, we're looking at what's next and what can we do. We are sending out a lot of invites to that 65 plus. It does seem that we're getting through a lot of them just based on how many appointments are being scheduled, but we continue to push out invites this weekend as well as through this week. Again, just to circle back on, you could get a notification through this email or app, but if you don't have those things, then the other method of communications would be a robocall. So you would get a phone call that gives you a message, here's how to schedule your appointment, and that's how you would make an appointment. We still have, concerns and issues with not knowing what we're getting on a weekly basis. So I can't plan out 2 months from now. Every week, I know the state is really making all efforts to improve that, but every week is somewhat of a surprise in that I don't know, what type of vaccine I'm going to receive and what day, how many. And, of course, as you can tell, this complexity of all of this is not to be underestimated. We have 2 different types of vaccines. Both of them require different storage solutions. Both of them require different time frames between first and second dose. So if you think about like the Tetris that our team has to play on, okay, so this day we're administering this vaccine, 21 days or 28 days later, we have to repeat the whole thing. We have to make sure that we don't have conflicts with another first dose clinic day. So it's pretty complicated. And then additionally, the vials come in a certain, you have a certain amount of doses that come in each of the vials. Oftentimes we can pull extra vials. So sometimes we're calling people that still, we focus on the ones that still meet the criteria, but we're calling people to say, can you get here in half an hour? Because we don't want any dose to be wasted in addition to all of that. So very complicated, but also, like I said, very fun. The teams get really excited to volunteer for shifts over there. And it's just really rewarding for them to be able to offer this service to our community and make their day. So just, kudos goes out to the entire hospital, the entire community. It's just been pretty amazing what we've been able to do for our rural community. And so with that, I'm happy to answer any questions. I'll stop sharing screen so we can see.
Looks like we've got a question from PJ to start.
Soniya, great presentation. Thank you so much. How is the immunization being paid for?
The vaccines that we get?
Yep.
Yeah, so we are not collecting insurance cards. We're just offering the service. And we are not, we're just not collecting money on it. So it's just a service that we're offering back to the community. So just so you know, though, we could actually ask for insurance information. There are providers that are asking for that information, and they are billing for the insurance. We've chosen not to. We just feel that it's our public health service that we want to provide to the community.
Thank you for your generosity.
Yeah, of course.
Steve, do you want to unmute? I saw you waving.
Yes, Sonia, you mentioned that you have a sexual assault examination room as part of the new renovation. Do you have a certified SANE nurse? And I'm wondering, in Jefferson County, where I was a district attorney for many years, the SANE nurses now are doing domestic violence examinations as well for strangulation. And are you doing that as well in your examination room?
You know what, I don't know the answer to that to respond for certain. Right now, we are training our forensic nurse examiners. So we've gotten a lot of interest internally to do that. So I'd have to check to see if that would be part of their training. I would think that absolutely we would want to offer it as long as we have the competency to do so.
Thank you.
And we do offer the service right now. The difference in the new renovation is that we actually have a dedicated room with that private bathroom, just a better experience for the patient. Yeah.
Jim?
Did you say Jim?
Yes, I did. There you go.
The only issue I've encountered for me and for others, and thank you first of all for all you've been doing for COVID, is I got a call from Lions and I said yes. And then the next day I got a indication through our health connection from UCHealth, because I actually go to the medical associates in the same building. There was no way for me to notify UCHealth that I was already taken care of and to remove me from the list. And I've heard that from people in the snow ski line when I'm waiting in the morning, and I encountered it myself. I called 2 different times, and the person who answered the phone at the hospital didn't know who and just said, just ignore them. And I don't think that's a good solution.
Yeah, we've definitely heard the feedback. I appreciate that. Yeah, I think at this point, what we're asking you to do is go ahead and decline the invite, because if not, you're going to continue to get put back into the pool and get invites. I know some people were concerned, if I decline, I don't want it to be perceived that I'm not interested in the vaccine. I just got it elsewhere. So we've definitely escalated. Is there an option that someone could click on, I received it elsewhere? And so we're working on that. Yes, between public health and Lions and South Route Medical Center, all the information does go into a state database, but what we don't have is the ability for it to come back down. So all of our information uploads to the state, so the state knows the number of vaccines that we've administered and to who, but we're having a problem with the downstream of that as well, to say, yeah, this person did get it elsewhere, so we can remove them from the list. So yeah, we thank you for that feedback. We'll continue to work on that and see what we can do.
That's why I didn't decline, because I thought it would reflect badly on people declining when we do it for ourselves and for others. But thank you for your answer.
Yeah. So if you decline, then it at least opens it up to somebody else. If not, you'll just get put back into the pool. But yeah, I get it. We don't want that to be an issue as well, where people think that it's I'm not interested. And so I've had a lot of inquiries around that too. But I think to be conservative too, we are ensuring that we're accessing everybody and anybody. So yes, we do ask. Yeah, we might call you, and we made hundreds of calls one day, and a lot of people were like, I already got it, you should know that. And we get it, and we know that it's inconvenient. We just don't want to miss anybody either. So we might, it might be a little bit overwhelming, but we'll do our best to try to streamline that.
Randy.
Hi, Sonia, this is Randy. I wondered if people have gotten over their reluctance to come in for standard medical exams, scans, routine medicine. They need to take care of themselves if they have any kind of symptoms or anything like that, or whether that's still an issue.
Yeah, I would say, it definitely was. I think we shared with, the community, we knew we needed to reassure our patients of the safety here at the hospital. And so we did see a lot of that reluctance. I would say it's definitely gotten much better. And there might be a very, very small population of folks who are a little reluctant to really, go anywhere. So we're happy to work with them in looking at, certain hours that we can have them come in for their appointment. Or different protocols that we can put in place to ensure that they feel safe. But yes, we definitely had a lot of significant delays, I think, of patients delaying their healthcare that impacted them in a negative way. And we definitely wanted to make sure that we were reassuring everyone that we're safe and we have the right protocols in place to ensure that safety, just like every other business is focused on. So it's gotten definitely much better than it was last year. But I would say there's still a good handful.
Larry?
Yeah, hi, Sonia. Thank you for a great presentation. And as a senior local here, the improvements to the hospital, really great news to me and to the community. I have a specific question. I've been keeping track of COVID incidences, and you had a graph with numbers over time, and there were 469. I don't know what the units were in December, and today 87. Is that a weekly total? And is it people that actually hospitalized? because in the last month, Broward County had a big spike. And if that is the case, it would seem that people are getting COVID, but they're not going to the hospital and getting admitted. Did I get that right? Is it a weekly number?
It's a daily number. So as of the Monday, we had 99, and it is hospitalizations with COVID diagnosis or even rule outs. So that 99 is you might have it and we're testing you, you're in, process of being tested, but you're here for COVID related symptoms. So that's as of February 17th, it was 99 current hospitalizations across the system.
In that day.
On that day, yeah.
No, that's
yeah. So
impressive.
today, like when I pulled up the report today, it was 87. So you see it's going down. I mean, well, you can see on that chart, you have a few blips every once in a while. But we are seeing that trend decline. Yeah. And I would say, just so you all know too, for here locally, since the beginning of the pandemic, I don't have the exact number, just because there's nuances with our data in that sometimes people can be here with COVID, but not necessarily being treated for COVID. So for example, you could have a laboring mom who's COVID positive, but we've probably taken care of over 50 COVID positive patients here at our local YVMC hospital since the beginning of the pandemic.
Any other questions? I'm sorry if I've missed you waving anyone. I think that might be it, Sonia. Oh, there's one. Chris Hammond.
Great presentation, Sonia. Thank you. How many COVID patients are in the hospital today?
0. Yeah, I would say in the last few weeks, when we were hearing that surge that you were hearing about from public health, we were seeing a good consistency of 3 to 4 patients every week, which was probably our biggest surge since the pandemic. It was a little bit more consistent when we were hearing those higher numbers in our county. But, oh, and sorry, back to the ICU piece too. Yeah, most of I would say about 2/3 of our hospitalizations have been consistently non-ICU. So I feel that that's a difference between the beginning, the spring peak versus the fall peak, is that I think in the spring, we probably had a lot more in the ICU. I would say probably over the summer, we just learned how to take better care of the COVID patients. And so we saw a lot less ICU and more non-ICU, but still needing care, hospitalized care.
I was talking. How embarrassing. Which is a good intro to my next question. Paula Black, who's always on mute asking questions.
I'm not on mute right now. Sonia, thank you for the presentation. And the one thing I want to say is, given our discussions in the past and I've had discussions with Karen, the fact of how UCHealth sort of appeared in the Yampa Valley with what I consider to be a very big and heavy foot, I want to congratulate you both for working hard, number one, to turn around that perception in the community. And quite frankly, number two, for doing something that hasn't been done previously, and that is putting foundation money out in terms of wellness outside the doors of the hospital and out into the nonprofits in the community that deal with our citizens on a day-to-day basis. So thank you for that effort, to both you and Karen. Thank you for what you're doing, and congratulations on handling everything through the takeover from UCHealth and through a pandemic and expansions very gracefully and appreciated, in the community. So thank you.
Thanks, Paula. I appreciate that.
And for our last question, we'll go to Alice, who's on mute and not visible. Alice, just so you know.
Well, I'm my hair's sticking out all over the place and stuff. Sonia, I just want to have a comment. I got my first COVID shot last week. I can't tell you how impressed I was with just everything the moment I walked in the door, and how the staff was, and you got to be commended for that. It's nobody likes to get a shot, but it was a really good experience. So I just wanted to tell you that.
Yeah, thanks, Alice. Yeah, I mean, so that was one thing I didn't mention about the complexity of what we're doing here. And, there's a 15-minute observation period. And so all of this is being done with social distancing, right? I mean, all of these nuances that you would have never have imagined. And yes, the team here has done a great job in that workflow of just moving the patients along. And we've heard the same positive feedback. I appreciate you sharing that.
Well, thank you, Sonia, on behalf of the club for the update, for all the hard work. I'm sure if there are any other questions, people know how to get in touch with you. Paula, is there something else you wanted to add? Or
Yeah, I just wanted to quickly ask that as we get into the spring and into the summer when we're vaccinating perhaps a greater number of our citizens as the age goes down, have you all given any thought into drive-in shot clinics so that you can handle more people in a safe distance once it gets warmer?
Yeah, absolutely. We've seen it work in Denver, as you've probably seen in the news. So yes, we've already started planning and logistics. We've talked to public health about that as well. We even talked about what if we had to do it in the winter? Could we, is there a place that we could even accomplish it in the winter? So yeah, we will absolutely talk about that. The observation period, it does create some complications to it, but we will be looking at that. The Friday that we started doing the 65 or the educators, the Friday before Blues Break, we were able to administer 325 vaccines on that day, and that was our biggest day. And the staff said there were still some lulls and some downtime, and we could have probably administered about 370. But again, we want people to feel safe, right? We don't want it to feel crowded. We want everyone to feel safe, so balancing that. But yes, we will be looking at other options as well. And again, a lot of that's going to also depend on supply. We don't want to go through have the drive-through and mass vaccination clinic if we don't have the vaccines to make that worthwhile. But yeah, so a lot of it will be dependent on our supply.
Well, thank you again for everything. You know that in Rotary, you've got allies who, as an organization, have experience vaccinating the world. So if there's anything you, YVMC, the health department should need help with, reach out to us. We're here to help. Thank you for everything.
Yeah, thank you all. I appreciate it.
Unfortunately, everyone, Jillian had to go. She got a call that her mom is out of surgery. Everything is going well, so I'll kick off good news with that. She wanted to contribute $10, and she wanted to apologize for leaving early. With that, I'm going to take over with my new background. As the interim president, I'm going to suck up this power and until I need to acquire it permanently in July. And Angie Wood has agreed to run Good News today. Angie, are you? I don't see you. Where are you?
I'm here.
Oh, there you are. Angie, please go right ahead with Good News.
Yes. Yeah, hopefully you can all hear me. I know that from time to time I freeze. So if I do, please someone send me a message in the chat box. And Mark, maybe you'll help me to see everyone as we go through this.
Of course I will.
Okay, well, I understand that we don't have fines in this particular club, except if maybe someone's phone rings in the middle of all of this. But all of the money that's collected goes to the scholarship fund. So I'm going to kick off today by putting $50 in for Sonia's wonderful talk. And I've had both my vaccinations and have been extremely impressed both times I've been to the hospital. And the other thing I'm going to put my $50 towards is the integration of behavioral health into primary care medicine. Having been a psychiatrist for 150 years, it's a subject near and dear to my heart. So thank you for that focus in the work that you do. Okay, I looked for my dog, but to cull some support for the money being given, but the dog won't come in and I don't have any babies. So who will start off and help me out?
Angie, I'll send you.
Can I see any hands? Coleman.
There you go.
Coleman, yeah.
Thank you, Angie. Yes, thank you. Angela,
please put me down for $20. Soniya, great presentation. Thank you very much for your time and for the information. Very much appreciated. I guess first, just a big apology for my absence. I've missed several weeks here. So it's great to be back, and more than anything, great to see all your wonderful faces out there. So thanks.
Okay, Chris Hammond, I see your hand up.
Hi. My good news is I just finished a song, and I'm going to share it with you because it's very timely right now. Thank you, Dolly Parton. COVID-19, COVID-19. I'm begging of you, please don't take this man. Vaccine, 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 vaccine. I want that shot as quickly as I can. Frustration is beyond compare, not old enough for Medicare. I will need protection from COVID-19. I'll drive to Craig, do anything. I'm longing for that little sting, but it seems I'll never meet with you, vaccine. From Lion Drug to VNA, at 5 o'clock I'm on my way to see if there's an extra dose vaccine. The Rona's chasing after me. I've got to get you first, you see. That to me, it's just a race to me, vaccine. COVID-19, COVID-19. I'm begging of you, please don't take this man. Vaccine, 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 vaccine. I want that shot as quickly as I can. My day will come, I don't know when. Roll up my sleeve and jab it in. You're the only one for me, vaccine. Until that day, I'll run and hide. Until that day, I'll mask and hide. Hand sanitizer by my side. And I will never be denied vaccine. Thank you.
Bravo. Thank you, Chris. Thank you. Kit Pollen.
Hi, Angie, it's Pete. And addressing
Pete,
your fines, by the way, Soniya, brilliant presentation. Really enjoyed it tremendously. Great execution. Regarding your fines, Angie, I am fine, but it's proper to play the Beatles song 64 when I'm 64. And so I owe you $64. Cheers.
Well, cheers to you. Thank you. Thank you. Heather Martin.
I want to put in $20 for Soniya also. Thank you so much. And I also am such a fan of your integration with behavioral health in our community. When I was at Routt County, that was such a integral part of our entire community. So thank you so much. But really, Chris Hammond, where are you? What's the name of the song?
That's well, of course you can't, it's kind of embarrassing. It's Jolene by Dolly Parton.
Well, I know that, but what's your song?
Vaccine.
I thought maybe it was the Rona Chaser. Or are you just the Rona Chaser?
The Rona's chasing after me.
The Rona's chasing after you. That was so awesome. Thank you so much. What a treat.
Thank you. Winnie.
Okay, $10 in the hat for. Up. Yep, thank you. Can you hear me?
Yeah.
Yes.
Okay, $10 in the hat for Chris because that was awesome. And then my good news for another $10 is that my newborn foster baby left yesterday. And so for the first time in 2 months, I actually slept through the night. It was awesome not having to wake up every 2.5 hours. And for that, I am very grateful. As an aside, if anybody needs any baby gear, please hit me up.
Oh, Winnie, thank you, thank you. John Weibel, I see your hand up.
And I don't turn 14 this year. Don't get a birthday on Saturday, but somewhere in between, or Sunday and Monday, I get another year older. Yeah, anyway, so 54 into the pot for me.
Happy birthday, John. Thank you. Thank you. Carl Gills.
Yes, Chris, you just bumped up my my contribution. I was going to do 10, 5 for a great presentation by Soniya, 5 for the snow that we had this week, and now plus 10 for vaccine. So 20, Angie.
Thank you. Thank you. Do I have any other takers?
I'm looking, Angie.
Come on, we've got to. We've
Rich
got to
Glore. Rich Glore,
Yeah.
please. We're dying to hear from you, but you're on mute, bud. We have to figure this out. Do we have any lip readers? Yeah, call for your support.
Nope.
Got a couple others. Rich, get your stuff sorted out, and we'll go to somebody else while you're. No. He says no. Linnea, why don't you go ahead while Rich figures out how to unmute himself?
Sure thing. Thank you. Please put me down for $50. I have a pitch to make. But first, Soniya, thank you very much for your presentation. I was late, unfortunately, and missed the first part of it, but I know the work that you're doing, so thank you. Chris, thank you for making my day. Oh my gosh. And Winnie, thank you always for the care that you give to Routt County's foster children. My pitch, hopefully you got my email. It's for the Manic Ignite Pentathlon. Rotary has historically put teams together for these kind of community events. I, for one, definitely need to be ignited to get some enthusiasm and excitement in my life. So I'm very excited to be on a team for this. I know Jillian is planning on participating with her family. I presume PJ is going to be doing this. I don't know if solo or on a team, but he was actually one of the, I'll say, instigators for this being put together. So thank you for that. If you sign up through the code that I sent out in the email, it's $40 to sign up, but Rotary is going to get 20 of that back. And there's 5 different events. You can do it individually or as a team. We do have one member already that's expressed interest in having what I'll call a non-competitive team, because they can't actually do it that weekend, but I'm going to say that's okay too. So just let me know if you want help organizing yourselves into a team. So thanks.
Yeah, PJ shared that during announcements also, but he neglected to mention that Rotary gets a benefit out of this, and he's shaking his head now and grinding his teeth. Rotary gets $20 for every entry fee. So as Linnea shared, as PJ neglected to share. So yeah, we've heard enough about it, but thanks. Paul.
I apologize. That was me being late again.
Oh, that's all right. That's all right. Paul, why don't you go ahead?
Yeah, can you hear me?
Mm-hmm.
Good.
Yeah.
I just want to thank Soniya for that wonderful presentation, and $10 for Chris. And only though, if you will please email us or send us your song recorded so we can share it with our loved ones.
Paul, I'm gonna get that up on YouTube before I get the rest of this meeting.
Great.
Angie, sorry, I'm gonna go ahead and take over because I see people waving. I know Karen Schneider has something she'd like to add also.
Okay.
Soniya, thank you again for everything that you do and your great leadership. Chris, there are simply no words. And now every time I hear Jolene from Dolly Parton, it will never be the same. Winnie, I can't even imagine the size of your heart. Thank you for all you do. And ultimately, this is about contributing $96 to honor my dad's 96th birthday on Saturday. So, yay.
Thank you. Thank you.
Angie, I've got a couple.
Rich, are you?
Oh, Rich is going to go.
Okay.
Yeah, Rich, please, by all means.
Okay. Well, I've been complaining about the fact that I didn't have a place to live for the last few months. And we bought the place we've been renting. So now we're living at the same place and we love it. It's half the space we had before, but now we're loving it and we're moving. We've already moved in, so it's a matter of just enjoying it. I put $10 in for that one. Okay. Bye.
Thank you.
Well worth the wait. Angie, I just have some comments I want to get to in the chat while other people think about good news they want to share. Margie contribute $10 for Jillian's mom, Diane, with whom she and Holly play pickleball. Let's see. Steve Sainer wants to contribute $25 because of Chris's song. Chris, you're doing me huge favors here. I'm going to have to report back to Jillian with all the money that I raised all on my own. Paula says, Ange, I'll put in $25 for Chris's song. Awesome. Let's see. I know there was another one. Chris Hammond put me down for $25. Fantastic. And then Tara added, she wants to put in $8 for Winnie for 8 hours of uninterrupted sleep. You are an amazing giver, Winnie. Thank you for the opportunity you gave that baby and do for so many kiddos. Definitely worth sharing with the group. And now, Angie, I think we've got some more hands raised.
We do? Oh, PJ. PJ, I see your hand.
Yes, Angie, I would love if you were my therapist because your voice is so soothing. It is amazing. I mean, that would just be worth the price of admission right there. Thank you, Soniya, for a great presentation. Put me down for $20. And one other interesting thing that happens in our great community, we have the blessing of medical students doing the rural rounds in Steamboat Springs. And Ames and I have had the opportunity to host, probably a dozen over the past decade. And just got a call from her this morning. One of the medical students thought that they would live in their camper here in Steamboat Springs. I think they underestimated the chill. As you know, it was 3 degrees this morning. So I got a call from my wife saying we're getting, Clayton is his name, is moving into our place today. So we'll have him for a couple weeks.
PJ.
I can't. Can you see any more hands?
Let's see. Anybody else? Yes, I see Lori. Lori, you're on mute still. Okay. You can do it. There we go.
Sorry, I can't find my hand. I swear you took it away from me, Mark, so I wouldn't talk. But thank you very much, Soniya. As always, I feel so enlightened by every time you speak. I love what you have to say and what you do for this community. But you know what? Chris was a tough act to follow. You really made me laugh, Chris, and I needed that today. So thank you, thank you, thank you. And I'll put in $25.
Thank you. Thank you. Angela, I saw your hand up.
Yes, I was just putting my hand up. I also, because sometimes I get silent, I get direct messages. And Loretta Conway gave $20 because we're going into yellow. And then I'll put in another $20 because of Chris, you had me, I was laughing so hard, I was crying. Imagine that.
What a shocker.
See, I tell everybody I laugh as hard, I cry as easy as I laugh. And then Soniya, great presentation. Thank you so much. And Winnie, God bless for you doing what you do. Thank you.
I see. I see Rex put $20 in the chat box. Thank you, Rex. Any more hands? Any more hands?
Yeah, I see Chief Chuck with his hand up.
Ooh. Thanks.
Okay.
I'm going to make my my first venture into this giving of the hat. The first thing I want to say is I wanted to thank Rotary. The fire department received 5 thank-you-ary cards in January, and that was incredible. And the other few are posted up in the day room. So I wanted to thank everybody for your thank yous to the fire department. And I definitely want to reach out to Soniya and thank her for the partnership that the fire department and the city shares with UCHealth and the medical center here. And so I'll throw in $20 for that and my venture into this giving part for Rotary. It's very nice. Thank you, guys.
Thank you, Chuck. Can I see any more hands, any more takers? I don't see any more hands. No more. Oh, there is one. Where?
No, I said that might be it. Sorry to get you excited.
Okay. Oh, well, Chris, I didn't need a puppy and I didn't need a baby, but you certainly helped. Thank you. Thank you, everyone. Oh, we've got 642. Oh, golly, that's good. Thank you, everyone. Thank you.
That's fantastic. Thank you, Angie, for doing that.
Surely.
As a wrap up today, next week, we've got some new member introduction talks. Coincidentally, two people with the same last name, both Pete Paulin and Kit Paulin, not related, will be giving their new member introduction talks, which is how we're referring now to classification talks. So welcome to the Paulins. Can't wait to hear that. And yeah, all that being said, I'll adjourn the meeting right after going through what's coming up next. Tonight there is pickleball. I think, Loretta, we're all full. Is that right? I know with the new restrictions, we were able to up our participation from 8 members to 12, but I think that filled up pretty quickly. I'll have to choose a flattering outfit to wear. Rotary Ski Day, we're still keeping our fingers crossed for March 16th. Let's see, on, I don't know what this note from Jillian means about the Passport Club announcement. So we'll just let her get to that in the meeting wrap-up email. And finally, the March Happy Hour will be hosted by Karen Schneider on the 25th. More details to come on that. So unless there's any other business that people would like to attend to, I will formally close the meeting, and then we can hang out if you like for some chitter chatter. Thanks, everyone. Thanks again, Soniya.
Okay.
Thank you.
It's always good to have you here, Rich.
Okay.